Variety.
That's what I'm told.
Good afternoon, and thank you to the people of Mississippi for being with us today. And a huge thank you for what you are doing to help slow the spread of this virus. We know that we are in a fight, the likes of which we have not seen in many, many, many years in this country. This fight is serious, this virus is serious, and this virus is deadly. We are also continuing to reopen our economy because the threat of newfound poverty, and quite frankly, abject poverty, is serious and could be deadly for hundreds of thousands of Mississippians as well. Our Safer at Home order does not expire until May 25th, but I don't want to wait if there are things that we can safely do to allow people to return to work. To that end, I signed a new executive order today. It amends our current Safer at Home order. It allows tattoo parlors to reopen with health guidelines that are very similar to those for salons and barbers. It is an effort to affirm that there is no such thing as a non-essential business to those workers who rely on its paycheck for food and shelter. It also makes a few common sense changes to the order. Things like allowing local entities to decide curfews on parks, lifting curfews on dine-in restaurants that do not serve alcohol, and ending the prohibition on fishing tournaments. I want to also update the people of this great state on another reopening. We have been working with the Gaming Commission, and they have set a date and guidelines for casino workers to safely return to work. They will be able, should they choose, to open on May 21st. It will not be at full capacity, and there will be social distancing rules in place. But it is progress for an industry that employs tens of thousands of Mississippians. None of these reopening efforts mean that the danger is gone. You're smart. You know that. You've heard us talk about it day after day, day after day. Please continue to protect yourself, and please continue to protect your loved ones. It is an effort to fulfill our promise to the people of Mississippi. I asked you, in fact, I pleaded with you to help us, to sacrifice for a specific goal, to slow the spread so that our healthcare system will not be overwhelmed. I do not understand those people who say we cannot reopen until there is a cure or until the threat is gone. That is not what the people of this country, nor is that what the people of this state agreed to. The only authority that the government has comes from the consent of the governed. It comes from the consent of the people. We have to honor our commitments. Moving the goalpost in the middle of the game is counterproductive and just plain wrong. Personal responsibility is better than any government order. Guidelines are better than lockdowns. Trust with risk is better than unchecked government power. As we work to keep reopening, that's what we're all counting on. Please play your part. Please be responsible. Please look out for your family. Look out for your friends. Look out for your neighbors. Please look out for your fellow Mississippians. Together, we will get through this. At this time, I'm going to turn it over to Dr. Dobbs and let him talk about the most recent data.
Thank you very much, Governor. Updated case reports for today. We're reporting 318 new cases today to bring us to a total of 10,801. We have sadly reporting 13 additional deaths. 2 of those were identified from prior death certificates, bringing our total death count up to 493. If we look at who's been primarily impacted in terms of mortality, we know that there are several things at play. Primarily, it's going to be older individuals, and the vast majority of people who have died thus far have been over 60 years of age, but we do have deaths in a younger age group, including one between 18 and 29 years of age. If we look at what location is most at risk, clearly it's going to be long-term care facilities or nursing homes. And if we look back over the past several weeks, the majority of our cases, as far as deaths are concerned, have been occurring in nursing home environments. And for that reason, as such a high impact area where we can do a lot of good at preventing transmission, we are implementing our aggressive 2-week strategy to test every single nursing home in the state of Mississippi, both employee and resident, within the next couple of weeks. So just stay tuned on that. We're already getting that launched and activated. A couple things just to mention also, as far as hospital capacity, we seem to have relative stability in the number of hospital beds utilized for people with COVID. ICU and ventilator utilization has been relatively stable, although we did see a modest bump in the number of ICU patients over the past several days. This is something that, you know, we've been watching closely because coronavirus is still out there and people are getting sick. And if we think about people getting sick in the nursing home environment, they're going to be more likely to get severe disease and then, you know, require more intensive management. One other exciting announcement is that we are distributing the new antiviral medication remdesivir to hospitals across the state of Mississippi. Thus far, 14 hospitals in Mississippi have received a shipment of remdesivir. At this time, any hospital that is taking care of patients who've been critically ill with coronavirus are eligible to receive this medication to distribute to their patients in the hospital. This is not a miracle drug, but it does offer a potential opportunity for additional support for people who are hospitalized with coronavirus. The only other thing I would like to mention is that additional data is coming out on the survivorship rate of people hospitalized with coronavirus in a new study from Boston that's under review. You know, it looks like that the mortality rate is going to be less than 20%. So with good care, with the proper team that is adequately resourced, it's very survivable. It can be difficult to go through ventilator course and ICU support, but of people who require that level of support, survivorship seems to be more the norm than the exception. And that's all I have to report today, Governor. Thank you.
Thank you, Dr. Dobbs. I want to personally tell the people of Mississippi how much I appreciate President Trump and his administration. They have been very active in getting these doses of this particular medicine to us. We do not have enough. We are trying to get more. But I believe as we get more and more of these medicines, we will be able to get them out to the hospitals. It also gives our hospitals the opportunity to administer them, and then they can use their supply chains, hopefully, to reach out and attempt to do just that. I also want to thank Dr. Dobbs and his team, specifically Jim Craig, who has been with us a time or two, and Dr. Dobbs has been out in the field. They put together, after our conversations over the last several days, a 14-day testing plan. We recognize that those in nursing homes are some of the highest at risk. They put together a 14-day plan. Just so everyone understands the scope of this plan, there are 16,651 residents in long-term care facilities across the state, 10,705 staff. So we're talking about 27,000 Mississippians that we believe that we can get done over a 2-week period. This is a major step forward. It's going to be a major effort and a team effort between all of our partners, the emergency management people, the Department of Health certainly leading it, but also could be additional assets and resources from our great partners at the Mississippi National Guard as well. We want to work with those in both the government space as well as the private sector space with respect to long-term care facilities. This is certainly a challenging task, but one that I believe that we are up to. And I am so pleased that we've developed this plan and that we're going to get it done. Keep in mind, these nearly 30,000 tests that we want to do over the next couple of weeks are not supplanting all of the other testing that's going on throughout the state. And so while we'll certainly have some resources allocated here, we're going to continue to see a large number of Mississippians getting tested in other ways in addition to this particular mobilization. With that, I'm going to turn it over to Mac and let him talk about the emergency management team.
Thank you, Governor. Just a very quick update on some of our activities, mainly the Easter storm, the individual assistance that we have going on out in the counties. We're up to about 2,015 registrants for that disaster. We've had a jump to the designated counties of about 250. So the word is getting out. We've put out mail outs. We've also done social media, and we also have a center open in those newly added counties that came just a week ago. So we've been seeing a very good uptick there, and that's going to continue on into next week. The current numbers, in the individual and households program, we're up to about 2.5 million funds that have been distributed to individuals, and of that, the breakout in housing assistance is about $2 million and about $500, almost $600,000 in the other needs area as well, sir. Another area that I want to give an accolade on, the last time I was here, I believe Wednesday, we talked about some state partnerships, the agencies and how we work together, because none of us can do anything we do without the other. It's just paramount, whether it's Dr. Dobbs, Jim, that I interact with on a daily basis. We all have to partner up, and then we depend on those other agencies, the National Guard and others. And I've got some very good news about partnerships that Mississippi is number one, and we were able to affect actually the way FEMA does damage assessments in the counties. Normally you have something comes through and you have the local emergency management directors and others that have to go out and do their damage assessments. Then they get those numbers into us through our application that we have on your phone called Crisis Track. We can map out damaged areas, map out routes, tell you when bridges are closed or open so we can speed that part. Then we would go out and we would validate those damages. Okay, then we would request a letter to FEMA to do joint damage assessments, and that is the local EMA directors. MEMA goes back out, and then FEMA goes out with that team, and then we compile all that information, and then we have to write a report. We give it to the governor's office, and they do the final declaration letter to the president. About a 3 to 4 week process. It is not quick. Well, guess what? Things just got quicker. Because of the Easter storm, sir, and the COVID environment, we were able to talk with the geospatial officer for FEMA headquarters. He gave us a call and he says, look, I got this new camera. You can fly it and it'll do 3D imagery. And do you want to do it? And I'm like, well, yeah. So we popped that bird up on about day 3. We flew circles around the entire area. Out of the damage assessments we were flying with our own drones, all of my area coordinators, 8 to 9 of them are certified drone pilots. They're gathering footage as well. The locals are doing the damage assessments. We're all loaded in Crisis Track. I gave FEMA access to our program that the Department of Insurance co-bought with us to go in there and make this information immediately available. They're looking at my information and validating it. We validated it with also the Civil Air Patrol flight. We crunched that data in 24 hours, and we were hitting everything out of the park. Everything was a hit. Everything was a base hit, and there was no outs. And in the end, Tennessee and Nashville flew flights, but we put it into action because of the COVID environment. FEMA would not deploy their teams. We had to do virtual joint damage assessments and validate them and say whether or not we were going to get a federal declaration. Well, about June the 8th, that becomes a new policy at FEMA. We validated the program. It's done. We made it happen. Mississippi did. I think we're number 1 on the list on that one. So there's some great partners that took place. Civil Air Patrol, within 5 hours, they were on the ground, loaded the camera on their bird, and they were up and they were flying. So we've done some significant things to be able to pull that off. And FEMA called us and told us, hey, you're in. This is the way we can do business from now on. And it's so important because now you're saying damages happen. Within 8 hours, I can get a flight and fly it, 3D imagery, map it to it. Then I can send that map where the damages are to the counties. It even calculates debris that's on the side of the road. It will tell you how many short tons of trees are on the side of the road. It's a great application that they've come up with, and it's artificial intelligence, and it's learning, and it's getting better every time that it does it. So we really pulled this together. Our estimates on the ground, people doing it ourselves, as well as the county doing it, and then FEMA validating it, the numbers are very, very close, and that artificial intelligence is getting very smart. So, sir, we're proud to say that we've in this environment, we have again done some things for the first time that I think has been done, and FEMA's come up with a new policy and directive, and we got a new way to do business, and it's going to be faster. We could get a federal declaration within 14 days in your hands to sign and send off, not 30 days. That's significant. A lot of times we have to ask for an extension because we just can't get to every road in every county and make sure that they've met the threshold. We have to meet our threshold of $4.5 million, and sometimes that is very difficult. So now we have a way to get that done even faster and service that. We were even able to do the EPA's, Electrical Power Associations, to count their poles. Pretty easy when they're laying on their side, to be able to calculate the footage of how much miles of line they have. So it's a very significant event. Just got that information about 30 minutes ago that came into the office. We're real excited about it, and we're number one. That's all I have, sir.
Well, thank you. I can tell that you're excited. I know the people of our state can tell that you're excited. And what this just simply reiterates is that when it comes to emergency response, Mississippi is second to none. We are second to none. We've known that since the response with Hurricane Katrina through the years. Mac and his team, Director Michelle and their team, second to none. We are so blessed in Mississippi to have the talent that we have. But I want you to understand how important this is. If you may recall, after the Easter tornadoes hit, before we even knew that one tornado was the widest tornado in Mississippi history and the third widest tornado in the history of America, before we even knew that, the director of FEMA called me Monday morning, and I personally asked him for an immediate emergency declaration. I explained to him that we didn't have time to get the damage assessments, that this thing was so bad that we needed assets and we needed resources on the ground immediately. Well, he promised me that he would work on that. 3 days later, they had not had the opportunity to declare said emergency, and I had the opportunity to be on the phone with President Trump. I personally asked him to give us an immediate emergency declaration. It was done before sundown that day. But the reality is, on every single disaster that we have, we don't have the luxury of being on the phone with the president within a 24 or 48-hour period. And so these types of technology advancements can make a difference getting money and resources to the people who are hurt in the middle of disasters. And I just want to congratulate you for your efforts, and I'm proud of you, and I know Mississippians are proud of you as well. With that, I will answer any questions. Renee.
Dave Elliott with WLOX.
Let's let Dave go first today.
Dave?
Well, it's about time first. Governor, a question for you. Actually, a two-part question. I usually don't take requests when it comes to questions, but a state senator just texted me a minute ago and wanted me to ask you when you're going to sign the $300 million Mississippi Small Business Assistance Act. And a follow-up to that, there's about $750 million more still on the table. When you look at some of the priorities within federal guidelines, what are some of the things you might target in terms of spending that money? But again, when are you going to sign the small business bill?
Well, thank you for the question, Dave. You're more than willing to respond to your state senator friend that they could just text me directly if they wanted to. They didn't have to get you to ask the question. But we're going to sign it whenever we get done reviewing it, obviously. We're going to make sure that it complies with the federal guidelines. I know that the legislature worked very hard. We worked very hard with the leadership to get that bill across the finish line. We appreciate their hard work and look forward to working with them in the future. When we think about what comes next, we have a large number of priorities. I certainly believe that an area such as workforce development and workforce training is one area that we need to look at. We've got 220,000 Mississippians that are now on unemployment insurance. Some of them are going to be offered their jobs back, hopefully sooner rather than later, as more and more of the economy opens up and as more and more people are able to get out and actually increase demand in these stores as they are actually spending more money. But the reality is there are some percentage of those 220,000 people whose jobs and some small businesses that may be gone forever. That's a harsh reality of where we find ourselves. It breaks my heart to even think about it, much less say it. But the reality is that we have to take this opportunity to look at ways in which we can train and retrain our workforce, those who have been laid off. If we can take someone who was earning $10 an hour, train them through the use of resources that we have received such that they can then go and provide and be productive in jobs that are paying $20 or $25 an hour, well, then we will have utilized this horrific circumstance to make our people better. We have this week we have provided $300 million to small business owners. I think that was incredibly important. I also think we need to take those individuals, the folks back home throughout this state, in all 52 Senate districts, in all 122 House districts, in every single of our 82 counties, and we need to provide opportunities for those people who have been laid off, those people who are receiving unemployment benefits for the first time in their life. And so we are trying to put some meat on the bones of a proposal as it relates to that, and we'll continue to do that in the coming days and weeks ahead. There are other areas where we need to ensure that we expend resources to help our people. That's the number one goal that I have had from the beginning. I don't care who gets the credit. I don't care who does what. I just simply want money quickly to the people of Mississippi who desperately need it in these challenging times. Courtney Ann?
You've amended the Safer at Home order here as it relates to tattoo parlors in particular. I know there's not a playbook on this in terms of closing and reopening certain industries, so has it proven to be more difficult than maybe anyone would realize, especially if they're in that silo of that industry and they're just saying, well, isn't it obvious that my industry is like this other one that's reopening, to really get into the weeds and say, okay, this is how a reopening looks for this industry? I mean, it's more detailed, I would imagine, than folks would realize.
Well, and I think that's an extremely important point, Courtney Ann, is that when we decide to reopen an industry, and we have reopened the vast majority of them at this time, they tend to come with significant guidelines that are required to follow. I'll give you an example. The Mississippi Gaming Commission, remember, with casinos, I never shut down casinos, but we worked with the Gaming Commission and they decided to shut down casinos almost 2 months ago. Well, we worked with the Department of Health, we worked with the industry, we worked with the regulators, and the industry had one set of guidelines, the regulators had one set of guidelines, and then ultimately the Department of Health and I worked to make sure that we took the best of all ideas and made sure we protect people. And this is what came of it. And this was the release, the order that was passed by the Mississippi Gaming Commission earlier today. And what you see is guidelines that literally comprise 5 full pages of guidelines for every different operation, whether it's hotel or food and beverage or slots or sportsbook or casino cages or table games or all areas, all the guidelines they have to enact for all of their staff members, the things that they have to do as staff comes in and out of the facility, the ability of them to make sure that they protect not only their staff members but also protect those individuals. It's literally 7 pages that I have here, and that's on one industry. There are approximately, I forget the exact number, but 22 or 25 locations, however many there are across the state. I should know that. But those are the details that take time. And they take time, and it's better to get it right than to get it done quickly. But my goal is to get it done quickly and right for the people who need it. I've said here many times over the last couple of months, when we identified essential and non-essential businesses, we were at a time in this virus when we had local elected officials that were being very aggressive in shutting down industries that did not need to be shut down. They didn't need to be shut down because they were going to cut off the supply of food. They were going to cut off the supply of supplies that were much needed. And so we had to say early on, here's what the Department of Homeland Security says are essential industries, even in a pandemic of this nature, and we identified them, said you cannot shut them down. That was to slow local officials from doing things that we didn't think made sense. But we made a mistake. I made a mistake. I made a mistake because I identified essential versus non-essential. There is no such thing, and I've learned this. I've learned a lot, but I've learned this over the last several months. There is no such thing as a non-essential business to the business owner and the employees that depend on that business being functional and operational and paying them so they can provide for their family, so they can provide for their kids, so that they can put food on their table. That's a pretty essential business for those individuals. And so I admit my mistake in saying that. It was done with the best of intentions. I think it had some positive impacts, both from a public health perspective as well as from an economic perspective. But as is often the case in these very difficult decisions in the middle of a pandemic, it also had some negative impacts. And for that, I am sorry.
Patrick McGee with Sun Herald has a question. Patrick?
Yes, just a quick question for the governor. When does the order on the tattoo parlors go into effect? And for Dr. Dobbs, we noticed a change in COVID numbers in some counties in South Mississippi, including Harrison County, where they actually removed 9 cases from today's numbers. So I'd just like to hear an explanation on how that may have happened.
The order that I signed about an hour and a half ago goes into effect immediately.
And that's something we've had happen from time to time with different counties, is if someone lives in a zip code or that aligns with a different county, or maybe a city that sort of straddles county lines, once we do our geocoding for outbreak mapping, we identify that it's a different county. It's just a realignment based on better data than we initially were given from the case reports.
Hunter?
Thank you, Renee. Thank you, Governor Reeves. This question would be for Dr. Dobbs. Based on the fact that a little bit of numbers of potential mutation of a portion of viruses, I'm not sure if this one, how strong it might be, or if it is going to come down to that. But as far as opening up schools, events, and other things as such, has there been any calculation on the opportunity of where we're going here by school time starting?
Yeah, so that's a great question, and certainly I've been in conversations with the Board of Education and Dr. Wright, and I'm going to be meeting with her again this weekend. Kids got to get the proper education. It's critically important, and so we'll work with them to find the best and safest way to do it. I just kind of say stay tuned. We're still kind of learning more and more about the virus as the months go on, and it gives us makes us stronger as far as like our prevention strategies. But yeah, I mean, kids got to get back to school, and we're going to work aggressively with the Board of Education to try to find the best pathways for that.
Caleb with Daily Journal has a question. Caleb?
This is a question for Dr. Dobbs. I'm wondering how confident you are in the death toll reported by the health department, and if you're more concerned about either overcounting or undercounting, which do you think either of those are a serious possibility right now?
I'm really not very concerned about overcounting, because the vast majority of deaths have a confirmed lab report. And we have a very thorough process of looking through vital records. We're looking at the medical record, trying to find lab reports. So 99% plus of all the deaths are going to end up having a confirmed lab report, so we know that they actually were cases. Now, as far as undercounting, there is a possibility that someone died from a situation that was not counted as coronavirus. I think that's the more likely scenario. If someone had coronavirus and then had a heart attack, because of the stress. I mean, just as an example, that would not necessarily get counted because it might not rise to the attention of the healthcare personnel. So I think that's a more likely scenario, but there's no systemic sort of process that would that would unnaturally swerve it in one direction or the other.
Dave with WLOX has another question. Dave?
Okay, thank you, Renee. A question for Dr. Dobbs, if I may. Of course, all of these measures were put in place first to save lives, but secondly, to protect hospital resources from being overwhelmed. And you touched on that in your opening remarks. Currently, conditions on the ground on the coast, Memorial, 4 in the hospital, none in ICU. Singing River, 1 in the hospital, 3 in ICU. Dr. Dobbs, based on any kind of worst case scenario, do you think there's a possibility that hospitals in the state could reach critical mass in terms of PPE, needed beds, ventilators, or any other hospital supplies?
So it depends on when. So right now, and we monitor this very closely, we have significant excess capacity in ventilators. We have over 600 unutilized ventilators. It's a matter of sort of maybe regional stress. And so location is going to be important. We know that there are more cases in some areas of the state. Our mid-central is pretty busy. The other thing that we're starting to see is, especially in the Jackson market, where they're reaching hospital capacity, not because of coronavirus, because that's just the normal state of affairs, is they have a large number of hospitalizations in this area. But what I will say is, if we're looking toward a surge in the fall, which is a very plausible scenario, maybe even a likely scenario of cases based on what we know about past pandemics and the nature of this virus, this current experience has been very instructive about how to go forward and what we can do to prepare for something that may be quite likely. So at present, we seem to have a strong position as far as access to PPE and hospital capacity, but we will continue to work to make sure that for a more extreme scenario in the fall, that we'll be prepared for it.
Just as an example, as we think back over the last 30 days, on April the 21st, we had 86 patients on ventilators. We had a slight uptick overnight, and we have 81 patients on ventilators, most recent reporting from the Department of Health. If you go back and look on, for instance, on April the 30th, we had 454 patients hospitalized. Today we have 422 patients hospitalized. As I talk about the flattening of the curve, we have had a very flat curve for the last 30 to 40 days on hospital utilization as it relates to COVID-19. And in some indicators, we're actually seeing relatively steady declines, albeit relatively slow declines. When you don't go up really, really fast, you don't come down really, really fast. But at this point, we have not seen the stress from COVID-related illnesses on our hospital system. There are always stresses on our hospital system because of just the nature of our system, but we have been successful at ensuring that we're not getting tremendous stress on our hospital system.
Hunter with the Legal Gazette has another question. Hunter?
Thank you, Renee. Thank you, Governor. One last question, and I'm sorry to take up your time. The question would be, is after yesterday, with your signature of the bill, Governor Reeves, what's the timeline we are expecting for this, me being a small business owner too as well? We are going to start to see some of this, the avenue coming back towards us, the owners of small businesses, and where can we go to find out this information?
Well, thank you for that question. I can't give you an exact timeline. At this point, we've got quite a few people working on it. They have been working on it, and the timeline from my perspective is we will not get out money quick enough. No matter if we could get them out this afternoon, it wouldn't be soon enough. The sooner we can get money in people's pockets, the better, and that is going to be our mantra. That's going to be our goal, and hopefully we're going to be able to do that as soon as humanly possible. Courtney?
You will speak a little bit more to the antiviral drug. I think you said 14 hospitals had gotten it thus far. What is the distribution price? Is it just by request, or you guys are looking at how many cases they've had hospitalized, or what is that looking like?
We had an initial distribution of 400 doses, and so based on that number, we basically did a percentage allotment based on ICU utilization over the previous week, with a sort of a gated community activity, right? So like if you had some cases but the community activity is very low, you might get less of an initial distribution. So that was our initial distribution plan, but as we get more and more available, we feel that we'll be able to distribute a little bit more liberally based on hospital request. And so we look forward to getting more of that out soon.
Yeah, I will just say this initial distribution was made available because of HHS, because of the Trump administration. But I'll also tell you that everyone is getting more than they had last weekend. No one is getting as much as they want or need. It's just the nature of where we find ourselves in the cycle, and I hate that, but it is where it is. I have reviewed the distribution plan that the health department enacted, and it was done exactly as Dr. Dobbs has mentioned. Well, it is Friday afternoon. We are going into the weekend. We do have parks that are open. Hopefully we'll have good weather this weekend so people can get out and enjoy themselves. But again, let me reiterate a couple of things. Number one, I am doing a graduation ceremony tomorrow morning. And so if you have a senior that is graduating, that has completed their coursework, and you want me to read their name, please send it in to my staff. We're going to start, I believe, at 10 a.m. tomorrow, but if you'll go on our social media pages, there's a form that you can fill out. Tell me if your kid was a valedictorian or the salutatorian or the high school quarterback or played in the band or some other great thing, made all A's, made all B's, did a little worse than that. You just let me know, and I'll try to make sure that I get to every single name. The other thing I want to tell you is with the phased-in reopening, I need you all to do your part. You have been incredible. We asked you to shelter in place for 2 weeks initially, and then for a third week. Those were very difficult decisions, but you stepped up. You did your part. I told you at the beginning that I believe that we can only shelter in place for a limited period of time. It is not realistic to ask you to stay in your homes for weeks and weeks and months on end. Maybe other governors in other parts of the country don't understand that, but that's what I believe. You did your part. Because you did your part, we never saw a huge spike. We never saw the kind of utilization in our hospitals that we were afraid of, that we had planned for. You did your part. But just because we are now able, because of your efforts, to reopen certain areas of our economy in a safe, responsible way, does not mean you can let your guard down. I need you to continue to do your part. I need you, if you have a parent, a grandparent that is over the age of 65, I need you to help them stay at home because they are the ones that are the most vulnerable with this virus. If you know someone that is in that has one of those pre-existing conditions, I need them to stay at home. I need you, even if you're not symptomatic, to wear a mask in public, if you would. That protects you, and it also protects your neighbors. We as Mississippians know that we're the most generous people on the planet. You look at every single study for the last 30, 40, 50 years. We may not make as much as some of those folks in New York City make, but we give more of what we make than anybody anywhere in the country. The next few weeks, maybe even longer, is about giving. It's about giving to our fellow Mississippians by making a difference, by doing what's right, by helping, by protecting yourself, protecting your loved ones, and protecting your fellow Mississippians. I'm able to make the decisions that I make with respect to reopening because I trust you. I believe you will do what we are asking. I believe that you will not gather in groups of more than 20 outdoors. I believe that you will not gather in groups of more than 10 indoors. And I believe that when you do gather, you will exercise social distancing guidelines and measures. I believe that these businesses that we have allowed to reopen with very strict guidelines will adhere to them. I believe that because I believe in you. I believe in Mississippi. And I believe in my heart that working together, we are going to beat this virus. Thank you all. Have a great weekend, and God bless.